the organization's Médecins Sans Frontières says it's now had to withdraw its teams of hospitals from the Turkish hospital in Khartoum in Sudan because its doctors and nurses have been the victims of violence. MSF has been treating people in Sudan in the middle of the civil war there between the Sudanese army and the Rapid Support Forces. Monica Genya is from MSF's South African office. Monica, good afternoon to you. Well, what's happened to your workers, your staff who are working in Sudan?
Good afternoon. Thank you for having me. It has been a dire situation for healthcare workers in Khartoum, in Sudan, since the war broke out in April 2023. And we've suffered a lot with having healthcare workers harassed on their way into work, to the hospital, and back home from work again. It has become so bad that we are unable to guarantee the safety of our healthcare workers, and therefore we had no choice but to evacuate the hospital and suspend our operations there.
Has this been part of a deliberate campaign against your members? I mean, is one side campaigning against you for some reason?
There has been a blockade by the Sudanese authorities in RSF-controlled areas, and the Turkish hospital has been in that area. And so there seems to be some sort of blockade forbidding the transportation of medical supplies and humanitarian personnel. And this, I think the hospital became a victim of this blockade. We've been calling for it to be lifted so that we can get medical supplies, food, humanitarian personnel into the area. But so far, this has fallen on deaf ears.
When you leave, and obviously this would have been a difficult decision, I mean, the situation for your patients, how many people are you treating there?
Since the beginning of this year, we received over 10,600 patients in the emergency room. We were seeing up to 60 patients on average every day. We had an outpatient department that treated over 11,000 adults and over 7,000 children. And we were doing a lot of surgeries, C-section deliveries, all that work will have to stop.
I mean, this is going to leave people with really no health care. I can't imagine how difficult this decision must have been for you. You have a responsibility for your patients, but you also have a responsibility to the people who work for you. I mean, you're not doing this lightly. This is tough.
This is extremely tough, and no healthcare worker wants to leave their patients behind. We got to the point where we had authorities coming into the hospital and threatening healthcare workers with Kalashnikovs, trying to get them to treat war-wounded army personnel instead of the civilians who were coming in. So it got to the point where we cannot guarantee their security anymore, and we cannot, in good conscience, allow them to continue operations the way they were.
One of the awful things about this conflict, Monica, and I don't need to tell you this, is how little attention it gets. Everyone in the West talks about Russia and Ukraine. Obviously, the situation in Gaza is incredibly heartbreaking. Sudan, I think it's 16,000 people now dead, most of them civilians. Very little attention, unfortunately.
No, absolutely. And not taking away from other conflicts, which are just as serious, just as dire. But the Sudan has not been getting attention since war broke out in April 2023. We've been on the ground and we've seen a horrible, horrific situation with millions of displaced people not being able to access medical supplies and food. And malnutrition cases have started rising. It is something that the world needs to turn its attention to, and to help at least get a humanitarian corridor established so that civilians can get access to the care that they need.
Monica Genya, thank you. From the South African offices of Médecins Sans Frontières. Very difficult situation, of course, in that civil war in Sudan.